I'm going to analyze a scene from the first season of the TV show on HBO Max called The Pitt. The Pitt is a very famous show that's won lots of awards, starring Noah Wyle. And it is actually set in Pittsburgh, which is my hometown where I live. It's also set at the hospital, Allegheny General Hospital, where I did my residency. I did a combined internal and emergency medicine residency there, so I'm very familiar with the emergency department there and spent years there. So it's a really important show, and I'm going to analyze an infectious disease case that presented during the first season.
Kid in extremis, you were the closest EDAP. 13-year-old hypoxic and hypertensive.
He looks pale and tachypnic.
Flynn Edwards home alone with his little sister. Cough, fever, rash, altered. Tach at 150, BP 80 over 55, breathing at 36, and satting low 80s on the face mask.
So they're talking about a person coming to the emergency department, an emergency department that is under surge conditions because there's been a mass casualty shooting that's impacting patient flow there. And they're coming there and they're describing a patient that's in extremis with fevers, chills, rash. His heart rate is fast. So what that points you to is that this is a child or a kid that's in trouble, that has multiple derangements of their vital signs, which is pointing you, because of the fever, pointing you to thinking this patient has sepsis. And sepsis is life-threatening. You have to move fast. You've got to figure out what's causing the sepsis and you've got to reverse it. That's what we're seeing now. This is somebody that's going to be triaged to be seen very quickly, and we'll see what they find next.
Hi. What's your name?
Georgia.
Hi, Georgia. I'm Mel. Oh, yeah, that's scary. Yep. Georgia, where are your parents?
At the movies. Did you try calling them? I texted. Can you give us their numbers?
Do you remember what happened before you called 911?
Flynn was talking weird.
Okay. And then after he was talking weird?
He got super sleepy and then I couldn't wake him up.
There's a story here that this was a patient that was talking weird, became very sleepy, and couldn't wake up. That tells you that there is something going on with their central nervous system, their brain. Talking weird, being really drowsy, and then not being able to be woken up, basically progressing into coma. So now you couple that with the fact that there's fever, there's rash, there's abnormal vital signs. You're thinking this is some sort of brain infection or some type of infection that's impacting brain, which leads you to think this is maybe encephalitis. That's what the word means. It's inflammation of the brain. So there are many things that can cause encephalitis. Bacterial infections can cause encephalitis. Parasitic infections can cause encephalitis, and viruses can cause encephalitis. So you're walking down this diagnostic road, getting little bits of information that help you try and narrow down what may be going on now. So we've got a patient that is septic with a rash and has brain infection.
I have to go help your brother now, but Princess is gonna get you a snack.
I already brushed my teeth. And maybe just a glass of water?
Flynn, open your eyes, buddy. Start a second line. 2 liters of ringers wide open, 100% non-rebreather.
Crackles bilaterally.
Temp 101, O2 set only up to 82.
Shit. It's code sepsis. Blood cultures, labs, portable chest, gram of ceftriaxone. Dr. King, what are you thinking?
Rash.
So now you've got these providers recognizing that this patient is in what they call code sepsis. This is now a situation where they have to move quickly. So they put 2 IVs in this patient. They start giving him IV fluids. They recognize that the patient has a fever, that his oxygen levels are low, so they're going to be giving him supplemental oxygen. They are going to get blood cultures looking for bacteria that might be in his blood that are causing this sepsis. They're getting a chest x-ray to see, does this patient have pneumonia because his oxygen levels are low. They're starting to do things to try and treat the sepsis and also discover the cause of the sepsis at the same time.
Altered with sepsis could be meningococcus, strep pneumo, something viral like disseminated HSV, encephalitis.
BP's 82 over 49, set up to 87.
What about the rash?
Now they're starting to rattle off things that might be causing this infection. So they rattle off some bacteria like meningococcus. They're also thinking about viruses like disseminated herpes, that's disseminated HSV, which is a very common cause of encephalitis. They're thinking about what might be causing his infection, trying to narrow down what the etiology of, and this is the etiology is. And by etiology, I mean the cause. And this is sort of the great part of it. It's the detective work, trying to figure out what's making my patient sick. That's sort of what I'm intrigued with a lot with infectious disease, is narrowing down, trying to understand what it is that's caused this problem. And they're starting to think through those issues. They are also noting he has low blood pressure, which also goes with sepsis. Sepsis can affect the cardiovascular system and cause perilously low blood pressure.
What about the rash?
But it's more prominent on the lower body, not much on the face. There's no vesicles. It doesn't look like chicken pox or typical Lyme rash.
Agreed.
Do you know what this is?
Nope. Resuscitate first, diagnose later.
So they're talking now about the rash. They're talking about chickenpox, for example, Lyme disease, things that cause rash. It doesn't really look like that. So they're starting to rule things out. And then they say something like resuscitate first, meaning that you need to start reversing the end organ damage that's occurring with this sepsis. So that's the IV fluids. That's the oxygen. That's trying to support the organs while you figure out what's going on. These are not definitive treatments yet because we don't know what's causing it, but there's supportive things you can do to keep the patient alive so they don't crash.
Tubes in.
The color changed.
Nicely done. Present.
We have a septic 13-year-old with pneumonia. I just intubated, and ceftriaxone is on board.
Septic 13-year-old with pneumonia. So they've recognized this patient as pneumonia. They've also now intubated that patient. Intubated means they've put a tube into the patient's trachea, into their windpipe, which they then attach to a ventilator. So now this patient is getting artificial ventilation. They started ceftriaxone, which is an antibiotic, a broad-spectrum antibiotic that you would start in this type of setting. They don't know that it's not bacterial yet. They're still thinking this could be bacterial. That's why they're giving an antibacterial antibiotic agent like ceftriaxone.
Patchy consolidation, maybe some nodules. Could be viral pneumonia with or without bacterial superinfection.
Kid's got a weird rash, too.
Oh, and it's maculopapular on the legs.
Pretty faded on the neck and chest. Starting to desquamate. You ever seen anything like this before?
Nope.
Me neither.
Well, that just goes to show you how old I am. This looks like measles.
Measles?
Holy shit.
Now you have Dr. Robbie, played by Noah Wiley, giving the diagnosis of measles. So he first goes through a description of the rash, talking about its characteristics. Is it raised? Where is it? What does it look like? And then he says he's older, so he recognizes measles. And I think that Dr. Robbie's probably my age, and I haven't seen a case of measles. So that's a little bit of embellishment. But yes, measles is a disease that had been eliminated from the United States and is now coming back. And many physicians have not seen cases of measles. So it is going to take an astute clinician to realize that somebody might have measles. I think increasingly it's going to become common. There are already hundreds of cases in 2026, and we had thousands of cases in 2025. So more and more physicians are going to see measles, whether they like it or not. But there was a time when most physicians had not seen measles because of the success of the vaccination program.
Any travel history?
He wasn't able to talk before you intubated. Measles is super contagious.
It's not contagious if it's resolving. We need more history. Where are the parents?
Oh, they're at the movies. I'm sure their phone's off. But he came in with his little sister. We can talk to her.
What theater?
I don't know.
Chen, try every theater.
There's got to be over a
Start
dozen
with
in
the ones
Pittsburgh.
closest to where they live. We need to find those parents and call public health. Tell them we might have a measles outbreak.
Now we're recognizing that this is measles that's been going on for some time, and that's usually the case when measles has progressed to impact the brain. At that point, it's less contagious. So that's why the people are not necessarily gowning up and doing all of the personal protective equipment and negative pressure rooms that you would do sometimes with measles cases. And obviously, you would expect these healthcare workers to be vaccinated so they are protected. But this is an emergency. Encephalitis in a measles patient can lead to death. That's why they need to find the parents, and they need to alert public health because measles is the most contagious disease known to humans. So one case means that that person got it from somebody else. Who did they get it from? Are there more cases? Are there more unvaccinated people that were around this case, this 13-year-old. So that's what public health will do, is start an investigation, doing contact tracing, trying to see who else might have it, trying to figure out where this person got it, and putting out announcements to people that might have been exposed, and starting vaccine drives and giving immune globulin to people who are not vaccinated to protect them from measles.
Hi, Georgia. This is Dr. Robbie. He's going to ask you some questions so we can help Flynn. Is that okay?
Hi, Georgia. Can you tell me when your brother first got sick?
A week ago, I was already getting better.
You were sick too? Fever and rash like Flynn?
Has your family traveled anywhere recently on an airplane or to another state?
Orlando for a dance competition a couple of weeks ago.
And where on your body did the rash start?
On my face. Then it went down to my legs.
Okay, thank you, Georgia.
Is Flynn gonna be okay?
Now we're hearing that the patient's sister also had measles. So she likely was the conduit for the patient to get it. And the patient had been sick for approximately a week. So this is measles that's been going on for some time and then progressed to this complication of sepsis and likely brain involvement. The other thing you hear about is travel history. Anytime someone has sepsis or a fever illness, it's really important to think about travel, because travel-related illnesses can be missed. And travel is a risk factor because you're mixing with different people, you're doing different types of activities. So travel could put you in contact with malaria, but travel could put you in contact with measles. There are many parts of the country where there are measles outbreaks occurring. So right now, this is from season 1, season 2, you might say they traveled to South Carolina, which is where the epicenter of the measles outbreak in the United States is. And where this is set in Pittsburgh and in Pennsylvania, we have some cases in the eastern part of the state, but not right now in Pittsburgh. That's probably going to change eventually. But travel history is important to figure out what they might have been exposed to.
We're going to do everything we can to help him.
Story is consistent with measles. Plenty of opportunity for exposure in Orlando with all the international travelers.
Isolation?
No, because you're only infectious for 4 days after the rash starts, so we're past that point. But the altered mental status, he's in the right time frame for ADEM.
ADEM?
Acute disseminated encephalomyelitis, a post-infection immune response.
So a head CT and an LP.
Afraid so, it has a 20% death rate.
Now you're hearing about the fact that they're suspicious that measles has set off a type of inflammatory reaction in the patient's brain that has a very high mortality rate. And they're going to need to determine whether this is actually present. So they're going to do a CAT scan of the head, which will give you some imaging, some structure, some imaging of the structures of the brain. And they're going to do an LP, which stands for lumbar puncture, which in common terms is a spinal tap, where you're sampling the fluid from the body that surrounds the brain, surrounds the linings of the brain. And if that fluid shows inflammatory changes, that's suggestive of involvement of the brain, the meninges, the cerebrospinal fluid, all of that. So that's the next step that they're trying to do.
How did Flynn get measles?
From his sister. Hi, I'm Dr. Robbie. Georgia is fine. She's in our staff room. She's the one who actually called 911 and probably saved her brother's life.
Georgia was sick, but she got better on her own quickly.
Yeah, many people get better on their own, like Georgia. However, as many as 1 in 20 kids that get measles get pneumonia, like your son.
Are your children vaccinated against measles?
No.
The MMR vaccine is perfectly safe. Measles is not.
We're concerned about inflammation and possible damage to Flynn's brain.
Now they're interfacing with the patient's parents, and you're hearing about the sister having measles and having an uncomplicated case, and the fact that they're not vaccinated against measles. So the measles vaccine, which is contained in the MMR vaccine, is one of the most highly effective and successful vaccines that is perfectly safe. But there's so much misinformation about it that there are individuals who are not vaccinated, who choose not to vaccinate their children, and this is the consequence. As Dr. Robbie says, 1 in 20 children with measles get pneumonia, and this patient does have pneumonia, and now another complication involving the brain, which is more rare. But the thing is, measles is not a benign illness. Even if you have an uncomplicated case, it's miserable. And number 2, it impacts your immune system. Even in a mild case, you become more susceptible to other infections because it does this kind of immune amnesia. It interferes with your immune system in such a way that your response to other things that you might have been immune to is erased for some period of time. So this is not a benign illness.
possible damage to Flynn's brain and spinal cord.
The measles got to his brain?
Well, his head CT was normal, but the only way to find out if he's okay is to perform a lumbar puncture.
A spinal tap?
I've read about kids who've been paralyzed from a spinal tap.
There is zero risk of paralysis.
What about bleeding or infection?
It's a perfectly safe procedure. We do it every day.
We need spinal fluid to see if Flynn has acute disseminated encephalomyelitis.
And if he does?
We treat with high-dose steroids to decrease the risk of blindness, deafness, intellectual disability, even death.
He could die from this?
The death rate from ATEM is high, 1 in 5.
Do the spinal tap.
No!
Now you're hearing this debate over doing the spinal tap. And the spinal tap is perfectly fine. It's not something that's going to paralyze them. And it's going to give them information that helps them understand what's going on, what the next treatment would be, which in this case, where they're talking about an autoimmune encephalitis that occurs after measles, it would be to give steroids and other immune suppressants.
Can't you just give him steroids without the spinal tap?
If there's no ATEM, the steroids could suppress his immune system, making it harder to fight off the pneumonia.
But it says here
Can you put your damn phone away? Your son is critically ill. The longer that we wait, the higher the risk of permanent brain damage. What is not clear here?
Hillary.
What they're worried about now is that if he doesn't have this brain inflammation, if this is not something that needs steroids, giving the steroids, and remember, steroids are immune suppressants, they suppress your immune response. He's got a pneumonia as well, and that pneumonia may progress and get worse if they give him steroids. So they don't want to give steroids to someone unnecessarily. So they need more information to be able to guide their treatment, to make it more precision guided. That's the debate you're hearing there.
He has a tube down his throat.
They're
He can't
not
breathe on his own.
poking holes in my son's spine.
Wow. Okay.
Let's just wait and see if he gets better.
Dr. King, could you please take Flynn's parents to see their daughter?
No problem.
They are going to see their daughter.
Fucking Dr. Google bullshit. They want medical treatment, but they don't want medical advice. What the actual fuck are we doing?
Yeah, I know, and we'll keep trying. You okay, boys?
Yes. You ready to give this measles kid to Dr. Shen and go home?
Oh, no, I'm okay.
You sure?
Yeah. It's just, we repeatedly tried to explain the importance and low risk of the spinal tap, and the parents they're risking their son's life.
Hopefully they'll come around.
And if they don't,
We do the best that we can. Some things are out of our control. Dr. Shen, how are we progressing in here?
No improvement in the patient or his family?
Where is your wife and daughter, Mr. Edwards?
My wife took Georgia to the bathroom.
Okay. Well, your son Flynn is critically ill, and the longer that we wait, the worse this could get. Without the spinal tap, we don't know the best treatment to give him the best chance of recovery.
What's going on?
We were discussing the options for treating your son.
He already looks better.
He is not. And by refusing the spinal tap, we don't know how to help him. The steroids could kill him. If it's just pneumonia, the steroids could save him if it's ATEM. And the longer that we wait, the greater the risk of him dying.
Flynn might die.
No, honey, he's just got a worse version of what you had.
I'll keep him intubated, hydrated, and pumping the antibiotics. I'll let you know if anything changes.
Mr. Edwards, may I speak with you outside, please?
Go. I've heard enough.
Tell me about your son.
He's a great kid. He's kind. He's very good to his little sister.
You too close?
Yeah, not like my old man. He was not around very much. Didn't really care what we were doing.
Does Flynn play any sports?
Baseball, soccer, basketball.
David?
My wife doesn't want him playing football, or he'd be doing that too.
Do you get to many games?
I'm doing my best. What the hell is this?
These are the people from the Pitt shooting that we couldn't save today. We couldn't save them. But we can still save your son.
You're an asshole.
Dr. Robbie is now trying to persuade the patient's father that he needs this lumbar puncture to get more information. And what's happened is there's been a mass casualty incident in Pittsburgh during this episode. And he's showing him victims to try and really concretize the fact that those people didn't really have a choice whether they lived or died because they were shot by a bullet. Very different than a child whose parents chose to not to vaccinate them for measles, and now are choosing not to allow doctors to get the best information to precisely treat that patient. So it's all preventable in juxtaposition to what happened to those other victims that he's showing him.
Yeah. I'm an asshole. I was trying to save your son's life.
Yes.
How's he doing?
Same.
So he's not getting any worse?
Not at the moment.
Our family physician is making arrangements to move him to West Penn.
Will you excuse me for a second?
Not too
Our
shabby.
measles kid's parents are trying to move him to West Penn.
Let them. They've been warned multiple times. I even took the father into the Pitt Fest morgue to drive the point home.
You what?
Yeah, I doubt any hospital will take him without a spinal tap.
I'll be there in a minute. They'll let them move that kid.
Dr. King, we want you to do the spinal tap before Flynn gets any worse.
Great. I will meet you in there.
One more check of the transverse view.
Perfectly in the midline.
And the longitudinal view.
Right between the vertebrae.
Good to go. You're up.
Okay.
So now they're getting ready to do the lumbar puncture. Sometimes they will use imaging to make sure that they can get there. And this procedure basically involves feeling along the spine, the midline. You usually go around the L4, L5 region, the lumbar, the fourth and fifth vertebrae. In between the vertebrae, you stick a needle that's probably about this big, and you numb the area after you've sterilized it, and you push. And you're trying to get into this area there where the fluid is flowing. And you feel a sort of pop when that occurs. And then you pull the stylet out of the needle and you let it drip into test tubes, which are then analyzed. So that's what a lumbar puncture involves. It's a pretty standard and easy procedure to do when you can feel everything, when you have the landmarks, when you can get to the spine, when there's not arthritis, when you're not obese. But it is something that's very routinely done.
Is it painful? Will he feel it?
Not at all. He's fully sedated.
Enter bevel up. Aim for the umbilicus.
Oh, about to pop.
That's the supraspinous ligament. Enter slowly. Next pop is the ligamentum flavum. And you're in.
Felt it. All right. Removing stylet.
Okay, Dad, we're in. It's gonna take a minute to collect, but the fluid looks clear.
That's good, right?
It's a good sign. The lab still needs to run some tests, look under the microscope to rule out some bad stuff.
So they've done the spinal tap, and they say the fluid looks clear. Sometimes we call that a champagne tap because it's clear like champagne, which tells you there's not inflammatory cells there. So when cerebrospinal fluid is inflamed, the fluid might look cloudy. This one doesn't look cloudy, so that's good for the patient, but they still need to analyze it under a microscope to actually understand what's going on. But if something is grossly cloudy, that helps you. If it's clear, that's usually good, but you still need to do the microscopy to figure out what's actually going on there.
What are you doing?
You said she didn't want to be in the room.
I was getting Georgia something to eat. Wait outside. Stop what you're doing right now.
No, they're almost done.
I can't believe you went behind my back.
I did what was best for Flynn, not for you.
Take that needle out of his back.
No.
Yes.
Ma'am, I don't want to have to ask you to leave.
Take it out right now.
Yep. Coming out. Nah, all done.
My son is leaving this hospital.
She really is a good mom.
What you've seen here is what measles can do to somebody and why it's so important to vaccinate children against measles. You've also seen kind of a glimpse of what the anti-vaccine movement can be like, what doing your own research can lead to. And obviously it's a dramatization, but most doctors have been in this situation where you're dealing with a family member who has very diametrically opposed views to what is right for the patient. And you can see the physicians there say, we're doing what's right for the patient, not necessarily for the mother. You're treating the patient, not the mother. And that's what the father says too, because parents don't have a right to sacrifice their children. This to me is on the scale of neglect, when something like this happens. In real life, something like this could happen. It wouldn't just be the emergency medicine doctors. There also likely would be infectious disease doctors involved, as well as neurologists involved when you're thinking about these decisions. But I think this is a good encapsulation of what measles can do to someone, and why measles is not just some bygone disease that's part of the American experience, that it's something that should be prevented. This is not a good thing to happen. And the Pitt really did a great job dramatizing this. And I hope to analyze some more videos from that show that deal with infectious disease. So I hope you found that useful.